Thank you for joining us on FirstAlert4.com. I'm Caroline Hecker. I am joined by Dr. Al Sheckley. He is a neurologist at SSM. We are talking about strokes today. We talked about the story we were just speaking about with this woman who had a terrible headache when she woke up. But you were telling me that you can experience a variety of symptoms when it comes to a stroke. It depends on the kind of stroke you're potentially having. Is that right?
That's correct. So there are two kinds of stroke that patients arrive to the hospital with. The common one is that when there is obstruction of the blood flow, cut off of the blood flow, clots sitting in the brain, usually comes from the heart. And this kind of a stroke is much more common. Obstruct the blood flow leads to ischemia, means that there is no sufficient blood supply to that specific area of the brain, and that area of the brain is going to be damaged. So this is the most common by far. The second type of stroke is the hemorrhagic stroke, like the one which usually happen because of poor control of the blood pressure, or the person has an aneurysm they don't know about, or certain types of vascular malformation. Those people bleed, and when they bleed in the head, the very first symptoms is usually the headache. Headache is common with brain bleed more so than ischemic stroke.
So if you have an ischemic stroke, you may not even know it's coming on.
Correct. It can happen at any time. It can happen during sleep. People wake up with these kind of a stroke, or it can happen during the daytime. They could lose function of the body. So somebody who has paralysis in the limb, they cannot move one side of the limb, or their face doesn't look symmetric, crooked face, or they could lose vision. Some of them, they lose language function. They cannot comprehend, or they cannot express themselves well, or they lose balance. So there is variety of symptoms. There's a small test for anybody can do it at home. If they recognize that beloved person having some signs of stroke, do it at home. Very simple. It's called FAST. Look at the face. Ask the person to smile. If the person is able to smile and the smile is asymmetric, then this might be a sign of a stroke. Look into the arms. Ask the person to stretch their arms up. And if they drift in one side, that might indicate that some paralysis is happening. That's face and arm. And the third one is speech, S. Ask the person to speak. If they speak gibberish, they cannot express themselves, this is another sign of stroke. And T is telephone, fast, be fast, call 911. We do not recommend to put the person in your vehicle and drive that patient to the emergency room, because this is going to take a lot of time. But when you call 911, patient will arrive to the emergency room very fast. Sometimes we go beyond the fast and we say, be fast. Check the balance if the person lost the balance with the B. And check the eyes if the person hasn't been able to see, for example, or the eye jerks in certain direction. So all these are symptoms that anybody can check it on that person or that patient, and if they recognize these symptoms, please call 911.
And like you said, time is of the essence. The longer it takes someone to get to the hospital, the more likely they are to have more severe deficits, or how does that work?
Correct. So every minute, if the brain doesn't get that blood flow, every minute we lose about 2 million cells from our brain. Imagine 2 million cells. So every minute count when we see patients with stroke. When the patient arrives to the emergency room, we count the minutes. We take the person right away to the imaging center so we can look at the brain viability. We try to remove the clot as soon as possible. We try to reduce the brain bleed as soon as possible. So every minute count.
And strokes are survivable. When do they become fatal or very difficult to recover from?
This is a hard one because it is still the 5th common cause of death. So you're right, stroke is survivable. It depends on the amount of the damage happening in the brain. If the amount of the damage in the brain is vast, large, of course that person might not survive that stroke. Again, back to the time. If we get the patient to the hospital sooner, we can salvage the brain. We can that person will have a better chance for survival and better chance of functional recovery after the stroke, because stroke is still the most common cause of disability. So if we work on that person very quick, we minimize the amount of the damage in the brain, that person will have better survival and better functional outcome. So we look into how fast we can get the patient to the hospital.
So bottom line, get people to the hospital as quickly as possible if you begin noticing any of those physical symptoms that you described in the Be Fast acronym, and the hope is that that loved one will have the best possible outcome.
Absolutely. Be fast. The other things that if you have these risk factors, if you are hypertensive, pay attention to your blood pressure. Visit your doctor. Take your medicine. Check your blood pressure. If you're diabetic, same thing. Go to the doctor, check your sugar, make sure that you are well controlled. These are the risk factors that we commonly see with stroke. And the more a person accumulate these risk factors, the more likely they will have a stroke, and actually the more likely to have a bad outcome from stroke as well. So if you have these risk factors, work on them. Smoking, one of them, of course, heart disease is one of them. So there are many risk factors out there. If you have any of those, please contact your doctor and make sure that you are on the top of these risk factors.
And my last question for you, we talk about strokes not discriminating. They can affect anybody, whether you live the healthiest lifestyle or perhaps the poorest lifestyle. Can you talk about that when we look at age and race and all of those different factors?
It used to be, stroke used to be common among the older individual. But we saw this is not correct. Actually, we can see it in younger individual as well. And all depends on how healthy is that person, how many risk factors that person have. So now stroke does not discriminate. Anybody is susceptible. Of course, as the older you get, the more likely that you will have these risk factors accumulate in you, and you will have more likely to have a stroke. But it does not discriminate among anybody, different kind of race, different kind of people. It's risk factors. If you work on them, you will minimize that risk of stroke.
Is there a genetic component to any of this?
There is a genetic component for stroke, but it plays much less risk than what is commonly out there. Okay. Yes, there is a genetic component of stroke. We see this also in much younger people. One of them, the genetic problem of the blood clotting system. And so sometimes the blood clot on its own for genetic reasons. And that can raise the risk of stroke. We don't know this. I mean, we are going to be born with that. Is it important? Yes, it is important, but much more important is the common one, the high blood pressure, the diabetes, the smoking factor, the cholesterol issues, the heart disease. These are much more common in public than the genetic risk factor.
So living a healthy lifestyle, from what I'm hearing you say, can really go a long way in minimizing your risk for a possible stroke.
Definitely. Exercise, weight loss, these are playing a huge role in stroke prevention.
And last question for you, really, when we see strokes in very young patients, do we ever get an explanation as to how that happens? We've seen them in high school students, maybe college students. It just seems so young to be suffering something like that.
Yes, I mean, when a person arrives to the hospital, we dig into the problem. We try to find out what is the cause of stroke, especially in younger population, because as you said, high school student, college student, they don't have these common risk factors, the diabetes. It can happen, but it's less common. There are few things which is more common in young. One of them is a genetic factor. When they clot for unknown reason, their blood start forming clots. Or there's another condition called dissection, means that there's a tear happen in the vessels, and these lead to stroke. So yes, there are few risks among the younger population, but much less common compared to the hypertension, the diabetes, the smoking risk, the cholesterol risk, etc. So these are the ones that we need to pay attention to.
Well, thank you so much for joining us and lending all of your knowledge. I think it's great information for everybody. Bottom line, it sounds like try your best to live a healthy lifestyle, and you can minimize your risk for stroke. Thank you for joining us.